Hi, doctor. How are you?
I'm good, thank you. How are you?
What's happening?
Yeah, I'm in Cochin, so kind of things are going on.
But how's like the situation there? Are the restaurants opening? What's the general
Uh,
perception of the people? Are they like chilling or they're scared? What is the scene going on
I
there?
think I think that threshold of people have actually kind of crossed. So I think you can actually end up seeing a lot of people out nowadays. Not
Okay.
that it's not that people are not scared, but I think they're kind of frustrated and they just want to come out.
थक गए
So
लोग.
seriously. And I think the major challenge now is that even though the cases are increasing, you go out on a weekend and you end up seeing a lot of places with a lot of people. So it is, even though we don't have a choice, but I think we'll have to kind of take it as it comes.
Doctor, if like I was just reading about you, oh my God, you are like some Oscar award winner when it comes to gynecology and the department. Please tell us about all the awards you've won and all the accolades that you've won. There's so many I know, but you can pick five favorite of yours.
To be honest, it's not too many, but then whatever it is, like, see, I've two primary awards that I won, both were in the last year. And one was I was adjudged as the young IVF specialist in the clinical segment.
Okay.
I received an award for that the last year by ISAR, Indian Society of Assisted Reproduction, is the largest society of that is IVF specialists in India, and they did come up with an award for both clinicians and embryologists, young clinicians and embryologists, and which I won last year. And along with that, I was a part of ISA for last 10 years, and I've been actively contributing uh, the society and things like that. And last year, for my efforts, they had given me also a champion of ISAR, one of the uh, of the many people who are awarded the champion of ISAs. I was one of them who have helped in the growth of it. Thank you so much.
Oh my God, so much padhai you do. Even like, whenever I talk to doctors, they start with some terms which like go over the head. I always end up asking them, how do you remember and how do you spell those words? Like, it is an achievement. So, what is the first thing that you got stumped when you were in medical school? Ki, ye kya hai? What is this?
No, I see. I'm coming from a family of doctors, so my
Oh,
father is a gynecologist. So for me, even before, even when I was doing my MBBS. The first, if anybody even asked my grandmother like, "What is his like grandson doing?" I think she would say that I'm doing gynecology. Even before, even when I was doing my
even before you became a doctor.
yeah, like even when I was doing my MBBS and things like that. So my undergraduation. So being a doctor was always a part of what I think I believed I would be. Again, I don't know if there's always this thing that when you are as a part of the team of, like, say, a family, and then you proceed, there's always this challenge that people ask you, like, do you really want to be a doctor, or you've been pressured to being a
Forced
doctor,
to into it.
and things like that. I would say, as being, especially being surgeons, I think, because I always believe that you need to have a mentor, you need to have somebody who can guide you as far as doctors or your
Yeah, because it's
professional
mentally
life.
straining also because it's such a long padhai.
Oh,
By
correct.
in other professions, you work, you just study, do an MBA for 2 years or whatever, and then you like bang
Bang.
doing job. But in this, I think the technology is improving every day. You have to keep on reading about it, then you do MB, then you DMB, then I don't know how many courses you have.
So that is what. So I always believe that when we have somebody who's there to guide you, I think that would be the best thing. So probably I would say, compared to my contemporaries or my age people who are there around, I could do so much better, primarily because I was trained purely on this particular thing through from the best
Kind
people
of.
who have been
But do
doing
you
it.
think, doctor, like being a male gynecologist, disserves you at time?
See, I think there's two ways of thinking at it. I think it's again also the perspective of people who look into it. Like I said, my father is also a gynecologist, so it is something that, and I've seen my father see 100, patients a day uh, on a daily basis. So I think it is all about a perspective. Fortunately, Kerala being a state, I think Maharashtra is a state where you have a lot of male gynecologists. Bengal is a state that we have male gynecologists. But when I had gone out and did my post graduation in Chennai, male gynecologists were not a very big thing there. Like
How many girls were there in your how many boys were there in your class and how many girls?
when I was doing my gynae, obviously it's just two of us of the 24 people who were there.
You must have gotten so much of attention in your class.
It's always it's always a double-edged sword. So one thing is that you end up actually being noticed or noted too frequently. Definitely for the sometimes the women don't like you in the department. At the same time, there are also people who kind of prefers that they like you kind of surgically, there is definitely some kind of an edge that is there. So all that thing. So it definitely does give. And I think the biggest advantage, or probably the biggest this thing, was actually when you are with a lot of female PDs, most of them married with children, they have their own issues. We boys are the people who actually say, okay, you please take duty for us today, because we are not able to come. So we were always kind of relied on. So probably we had that kind of
so it's good. I think more and more men should opt this field. And aisa nahi ki, every woman at some point needs a gynecologist. It's a field that is every woman is going to use. It's a very lucrative field, and there's so much research that needs to be done. There's so much development that needs to be done, because right now we are talking about fertility. This is fertility month, and we want to speak about the subjects generally, in our daily life and all. We just don't think about it, and especially girls, who are in corporates and all. We don't think about like kids as such. Like initially 10-20 years back, when mothers were young girls, they still had in mind ki, you have to have kids. But nowadays generation doesn't think that much. But when it comes to the point, then Parasuram ji comes into picture. So please tell us, how does age affect the fertility in a woman?
I would say age probably is, I think, one of the most important aspects as far as fertility is concerned. I think no other field of medicine is so definitely affected by the
biological clock. Tick,
the
tick,
biological
tick,
clock.
tick, tick,
Like I think in a very popular interview of Indrani Noori, I think she did say that unfortunately the biological clock and your professional life actually kind of conflicts. And so for a very long time, if you look at say for a very long time, you could actually end up seeing a lot of these women getting married earlier and having children earlier without much of an issue. So if you ask me today if infertility races or the causes of infertility increase, it's basically not the causes of infertility that is increased. It's basically that we moving towards infertility that increases. So that is because of one of the major reasons, I would say, is late marriages and things like that. Age, I would say, is one of the most important factor, especially as far as females are concerned, because female age definitely is an indicator of the oocyte quality or the egg quality of the female as far as the child bearing is concerned.
But like market eggs, our eggs also have an expiry date.
Expiry date, unfortunately, yes. Till now, for a very long time, they believe that males did not get affected, but I think the recent studies do come in saying that I guess males beyond 50 or 55 to 60 do have a reduced potential as far as reproduction is concerned. But unfortunately, females are more important. Now, there's always this belief that males and females are equally responsible and thing. But whatever said and done, I always believe that females is so much more important as far as the reproduction is concerned. And that is why even a smaller problem in them creates so much of an issue.
Absolutely. But, I was talking to another very renowned gynecologist here. She said that, the average age, like 40, now the last age, I don't know what she mentioned, is in US and all. In India, it's lesser.
Correct.
The like good reproductive age. So what do you think is like the last till when we can stretch? Like I know there are exceptions, like every woman's body is different. But if you take in a ballpark or an average figure, what would that be?
See, even if you look at the overall, say, age versus fertility index, they would say that the best reproductive results or the best results for getting pregnant or doing some kind of treatment and getting an outcome is best till around 30-32 years. Okay. And beyond 30-32 years, your reproductive potential will start reducing. It's not that it will shut down, it will start reducing. See, even if you look at a procedure as advanced as an IVF, which is probably the highest treatment that is available today, 30, the best results is around 40 to 50% when your age is around 30-32 years. And over the time, like say after that there is a rapid fall in fertility rate, and by 36 they say around say 20-30%. Then by around less than 40 years, up to 40 years, it will be less than 20%. By 40-45 years, the chance of an outcome is less than 45, like less than 5%. So beyond 30-32, the fall in reproductive potential is significant. So that's why a lot of people, we always advise people or ladies or girls to actually get pregnant as soon as possible in majority of the scenario.
Okay, I'm going right now. As soon as possible, you said. Jokes apart, sir, of course, as Indra Nui also mentioned, there is a conflict when it comes to career and, having kids in women. So what do we do? What is the fertility preservation, and what, like freezing eggs, freezing sperms? How do we go about it?
Now, see, now before I touch on that, I think one of the biggest challenges that I see of today's couples and today's people who actually try for infant, I think today's couples are very well planned. They kind of are so planned that they say that, okay, I'm going to get married this year. After 3 or 4 years, okay, you're going to be more settled with your job, and then next 1 year I'm going to have a child, and then I'll be in a house, will be ready at that point of time, and things like blah blah blah. So that. But I think what happens in majority of the situation is that when they have a very good sexual frequency during that initial phase of the life, they do not want to have a child. And then what happens is, then when they want to have a child, the sexual frequency becomes only to have a child. And it's become more difficult. And then what happens is, I think a lot of people don't know that even if you're perfectly normal, when I say that even if you're perfectly all right, even if you have a normal husband and a wife, the chance of you to get pregnant in a month is not more than 20%. So it's not like it's only in movies that you see that you have sex once and you get and end up making them pregnant. It's actually getting pregnant is not that easy.
No, even I've seen like few of my friends or whatever, like becomes technical. The intercourse because sometimes it's like temperature and a lot of things that you have to keep in mind, and you like mark your ovulation calendar, and that day nobody's allowed to come in the house. That is strictly the day to bake the cake.
See, that's what. So what happens is after that, and then what happens is that first month they decide that okay, this month they're going to try and they're going to get pregnant, and within then they kind of do not get pregnant. That is when the things get scary for them. Then suddenly it becomes a big stress for them. It becomes too much of a challenge at that point of time.
It's
So
a vicious circle. Stress se aur bhi zyada, like when you take stress, and all the more you can't get it like easily.
True. And when it comes to fertility preservation, I think there are two basic reasons that we do fertility preservation. One is social egg freezing. That is specifically what you asked me for, and especially in women who are getting older, and you're not sure of your partner, you're not sure about when you want to have a child. So it is better that they actually, if they're younger, 30, 32 or 35 years below, which you can actually take their eggs out and freeze them, so that you actually have your young eggs ready for them to be used at a later phase. A lot of people end up doing it. The other group of people who use fertility preservation is especially in people who end up having some kind of cancers, especially boys or young men and women who, when they have cancers, they will end up taking a lot of these chemotherapy drugs, which can have an effect on the ovary and the test fertility, which might reduce. So once you do this, once you actually have the sperms and eggs retrieved and kept separately, even if once they do a chemotherapy or any kind of surgery, following which actually not necessary that you do these procedures that you're going to have infertility for sure. But if something like that comes, we always have a backup. So it is very important today that people are at least aware of something like this, that this kind of process is available today. When you're going for a chemotherapy, it's always better to freeze your sperm or freeze your egg before you go ahead with the chemotherapy, so that we can always have a backup.
So, but is there any age till when a girl should consider? And freezing an eggs, like we used to hear it in West a lot, but here I don't think so. Like people are doing it without any cause, like cancer and all you mentioned. But organically, I don't see a lot of people like women of 32, 33 doing it. Like
what happens today is that I think everybody has that thing of, at least they want to, they are quite positive about the fact that they're going to find a partner, they're going to get married, they're going to have a child. So I think people push it naturally. So they always try to push it to point of time. And because even if you look at, like, I wouldn't say in smaller cities like Cochin or somewhere where we have too many people coming in for social freezing. I do have few patients, but not really the amount of people like in what happens in Bombay or in
Delhi, no.
Delhi. We don't have that number of patients coming in for social freezing. The awareness is bad in such a way that they only come to you very late. They come to you at a point of
That's what
time,
I'm saying,
let's say
like, because
late.
my peers or like women I know, I'm like my friends, like I'm also 32, but none of my friends have frozen their eggs. So technically, this is the age when they should be doing, right?
It's ideal to be done. See, if you're looking at, or if you're realizing that you're not going to get married, like say in another 3 or 4 years,
3 or 4 years.
then probably yes, I would say doing a freezing
I
and
think
eggs
it's a
is a
good
good
thing
option.
because moms and dads क्या करते हैं बोलते हैं शादी करो, they keep on pushing you to get married so that you get to have a kid at the right age. Now you can say, see my certificate, my eggs are frozen, don't pester me.
That's a very important question. Like a lot of people ask you, like, what is your right age to get married? See, I would always say that whoever asks me this, or whenever there's a conversation on this, I always say that there's no right age to get married. You can get married at any time. When
Anytime.
you find the right person to whom you want to get married to, you can get married to them, whatever age it may be. But what really matters is your fertility. You want to have a child
That was
following that, then you need to get married younger. So it is not primarily because of the right age to get married. It's actually the right age to get a child.
But I want to know that, how difficult it is to freeze eggs. Like,
See,
is it very painful? Is it very, like, very invasive? Because
uh,
it is invasive.
yeah, I wouldn't say it is very invasive, but what happens is it's just like they'll have to undergo an IVF treatment. They'll have to undergo a lot of injections, produce you. What happens in IVF is actually, whosoever may be the problem, fortunately, unfortunately, the whole treatment is on the female partner or the women. And what happens is now her cycles or menstrual cycle is taken control of. You give them injections, produce more number of eggs. And once the eggs are ready, we kind of under anesthesia or even under local anesthesia or something, we actually aspirate the eggs through the vagina under anesthesia through an ultrasound guided technique. And
Yeah.
we can take those eggs out and we can always freeze them. So if you ask me whether it is invasive, yes, it is invasive. It is difficult. It is not that easy. You need to take daily injections to produce more number of eggs and things like that. So it is not something that is very easy to do. But probably if you look at the long way
Later
forward,
benefits.
the long way
It's like
forward.
having a safe deposit.
Correct.
It's like you are like mentally freer that, you can take your time to find a partner and you don't have to rush into stuff and,
So
just get married to have kids.
yeah.
So, doctor, how much does obesity affect the fertility in men and women? I want to know.
See, obesity is again one of the biggest challenges that we face today in our generation, or probably this generation of people that who come to us. I think both it does affect both the males as well as the females. As far as males are concerned, I think obesity does significantly affect their sexual function. So getting erection, or they don't really, they kind of not able to perform. And once it's like, again, like what you were saying, it's a vicious circle. You're not able to perform, and then you're not able to do it, then becomes an additional stress, and then you're
Yeah.
not able to do it again. So that is one of the, obesity has significantly affected the sexual function of people. And also in a large extent we have also seen people with obesity having poor semen quality also. And like I said, again, once the semen quality is reduced, definitely the fertility potential of the semen is also reduced. With
Full
regard to
chemical reaction has to
correct,
happen.
correct.
Both have to be healthy. But do you
Healthy.
see any time like when patients are interrupting, patients come to you and then blaming fingers because of you? No, because of you. Does it ever happen?
No, that's very natural. A lot of people actually do that. Actually, wherein they say that no. It's like, I wouldn't say that wife is very obese, but then you say that she's already become fat. She's not doing any exercise. It actually does happen. So I wouldn't say it does not happen, but I think it is about. See, it does not mean that obesity is not going. You would have seen hundred of obese people getting pregnant
Yeah.
easily, not having an issue. I'm not saying that all obesity is going to have a problem, but then when obesity is there, definitely is going to reduce or increase the chance of infertility in these group of patients. As far as women are concerned, one of the major factor that affects with obesity is that ovulation cycle gets deranged. They will end up getting irregular cycles and things like that.
Yeah,
So
and
they're not able
PCOD,
to time.
PCOS, and all these
Correct.
problems.
Correct. So all that will actually will change the way that you're trying to get pregnant, because they will not know the timing of ovulation. They will not know when it is happening, because all these hormonal fluctuation that happens, ovulation is deranged or affected, and then it becomes difficult for them to get pregnant. Difficult, not
Doctor,
impossible.
whenever you have time, you should write a guidelines about hormones. Please, we would want a handbook for hormones. What do they want? So many times I'm confused. Is it my hormones that I'm acting so weird, or is it me? I don't know.
That's again
But also,
always,
we get to blame hormones for anything.
correct. So it's always you never know what happens. No, it'll be like telling about understanding women. Yeah, I should write a book
You
on
should write a
understanding.
book about hormones. What men should do when women behave this way. How to understand women through hormones. But what about lifestyle changes? Like nowadays, a lot of people are getting diabetes and a lot of junk food and all that things. So how is that affecting when it is diabetes or blood pressure to fertility? How is that?
Like I said, today a lot of people do end up having lifestyle disorders like diabetes, hypertension, and things like that. And like I said, diabetes is one of the major factors for having any kind of sexual problems like erectile dysfunctions and things like that.
Yeah,
So again, because these affect multiple organs, it can cause different other systemic disorders in the body, and can overall your well-being can be affected.
affected.
Your overall well-being gets affected. Definitely your fertility potential also gets affected. Your sperm production, your sperm quality, all those things will get affected. As far as females are concerned, yes, again the oocyte quality is affected. But what is more dangerous as far as females are concerned is that when you get pregnant, when you're diabetic,
Yeah,
when you're pregnant, at that point of time, the challenge that happens is that the baby has the potential to develop some kind of abnormalities if your sugars are not under control. So
okay.
more than in women, especially more than them, like what do you say, more than the issue of them becoming pregnant, we are more concerned about them
Health of the child.
carrying pregnancy, because a lot of these complications are like hypertension, diabetes are associated a lot of complications in these people when they get pregnant. You can have some kind of congenital abnormalities to the babies. You can have unexplained fetal deaths
Oh my
without any
God.
reason we would not know. So we are always very concerned or very worried. And to be very honest, I would say, especially a state like Kerala, we end up seeing people who are getting pregnant, we end up seeing 60-70% of them developing some form of diabetes, gestational diabetes, or somebody like that.
Yeah, that I've heard a lot. But what about like if someone has diabetes or hypertension or thyroid, which is very prevalent in women?
Mhm.
So does that affect if you want to have fertility treatment later on, if you want to have IF and all? So does that intervene in that also?
See, like I said, definitely will have some kind of an effect. But like I said, more of a problem will come once again. See, obviously, with the age goes by, your
Goes down.
fertility will come down. With all these diseases, it's further going to come down. And then when they get pregnant, the complication rates becomes higher. These will add on to the complication rates. Advanced age will add on to the complication rates. So always there are multiple things which will act on multiple levels and will affect the fertility and
Absolutely.
childbearing.
So, but if you want to tell, like, at the age of 20, 25, 30, 35, what are the few things that women should do? Because as I was talking to someone else also in India, we don't have the concept of having a gynecologist. We just
Oh.
go when we have a problem.
Mhm.
While in West, like people have a gynae visit, like 6 months regular. I don't see that happening that much in India. Correct me if I'm wrong. People only come when there's a problem.
Sure.
So, what are the basic practices you should follow as a woman? Because we are blessed with this complicated reproductive system and hormonal system. So, what are the steps we should take, like, you know,
See,
well-being of our reproductive system?
understand. See, if you look at the fertility aspect per se, if you're looking at, say, I would say around 25 to 30 years should be at least kind of kept as a benchmark to get married. You don't go beyond it, because if asked earlier, what is an ideal age to get pregnant? Probably, if you look at the overall population in India, you would say majority of the people are getting pregnant somewhere between 20 to 25 is the maximum. But today we cannot tell that, because a lot of people see you do your a lot of people are very independent. You need to do your undergraduation, you need to do a post graduation by the time
Yeah.
you're getting married. So we need to give them that time. But then once they get married, they should be very clear and understand how the thing should be in front. I think it's always better that they get a preconceptual counseling, that they go and meet the gynecologist, find out, like you say, that you want to wait for some time. Is there a problem in me waiting for some time? They can actually check how your hormone levels are, how your ovarian reserve is. We have tests today to tell you that, okay, your ovaries are having so many eggs, so it's good enough. You can wait for some more time. So we
What is
can
the
do all
AMH, something like that, right?
AMH, correct. So you can actually do that and okay, say that, okay, yeah, your AMH is good. You can wait for a couple of years or you can wait for some months. So plan yourself, pre-prepared. And today, I think today, especially being females, I think probably it is an era where we need to do a regular health checkup. An annual health checkup is very important. Probably we are promoting that very much because this is also the cancer awareness month. If you are
Yeah.
aware, it's a breast cancer awareness month. It is also, I think, the cervical cancer awareness month was the September is cervical cancer, the next
Yeah.
is breast cancer. Because the biggest advantage as far as female cancers is if they are able to be found earlier. This is
Earlier.
something that we can be corrected completely without any problem. Because
So
you end up
after 30, you should get what test should you?
32 years, you need to have a regular gynae checkup with a pap smear and breast examination. That's what they say. Pap smear is, we need to do a small smear of the cervix. Cervix is the mouth of the uterus. Through the vagina, they do a pap smear there. There are specific guidelines today available with all the doctors that after 32 years beyond, we need to do, even it's even, they're very popular even in abroad, that every woman will go beyond 32, they need to go on a regular health checkup for looking at a cervical smear, and because and also the breast examination needs to be done on a regular basis. Like I said, if any of these issues are found earlier, this can be completely cured.
Treated.
Unlike a lot of other cancers where you do not have much of a choice, once it comes, it spreads, and then you will not be able to do much. But a lot of gynecological cancers are something that can be completely corrected and avoid. It can be completely cured.
But the gynecologist visit is not that pleasant.
I know.
And the instruments
I
also,
wouldn't.
like I was watching a show and said the instruments they use is cold and they like
See, I think because I think gynecologist, I totally agree to you with that. So sometimes, see, there's always that question: is what makes you a good doctor? I think the right attitude. I feel rather than having a lot of degrees, a lot of awards, a lot of this thing, I think it's the right compassion and having that the mind to do the best for your patient. I think that will serve the purpose as a good doctor, because once you have that, you will always try to do best for your patient. And like I said, unfortunately, the culture of seeing your patients and seeing your patients is very different to what we see in India, because it's a very large volume. Whenever we talk to our patients, we talk to the aspect because we know a lot of things. So we will talk to our patients with that perspective in our mind. Whereas the patient that walks in might have no clue of what we are talking about. Even if we say, like you were saying, a lot of these complex words or complex uh,
jargons.
jargons and whatever we use, probably. So it is very important as a doctor that you understand what they are wanting to understand and what they should clearly be understood, like what should be communicated to them. Like I said, whenever a patient comes to me for, I'm primarily doing only fertility for the last 10 years since I've come out of my post graduation. And one thing that we very clearly tell our patients is, like when they come to us, like I say, why are we doing this treatment for you? A lot of people don't know that why are we doing a particular treatment for you? What are your other options? Why do I believe that this is the best option, and
Best
that's why
option.
you're doing it? What is the best treatment for you? What is the success rate of these treatments? A lot of people see, unfortunately, even with an IVF, the best success results in the best group of patients is not more than 40, 50 or 60%. So the problem comes in, the patient comes with always a mind that is going to be 100% success rate. So
Because
what
for them it's first one and
First,
only time
first.
they've gone, right?
So it is very important as a doctor that we should always kind of try to explain to them as to why we are doing something for them. What is the success rate that they should expect? Because it can be different from different people. See,
Do you have
somebody
any story?
40.
Do you have any interesting story that any couple that you want to share? Any interesting story about a
So
couple?
I would say, like, there are many, but I think something that really startled me, like especially when you would ask me about age and things like that. There was a 40-year-old lawyer who came to me, a
Okay.
40-year-old lawyer, but I think she said, like, oh, probably she's very well off, and she decided, okay, let's now get pregnancy. She heard about IVF and things like that. She said, okay, I want to come and have an IVF done. So kind of like a very formal thing, we sit there, we tell them. Actually, what happens is, like I said, like I was telling earlier, age being the most important or the most significant factor. So I said that, see, there are certain things that you should understand. That now what happens is they've been married for 10 years. I think we've lost quite a good amount of time. But whatever is lost is lost. But you should accept all those issues now and start doing your treatment. And I told them at 40, you should expect around 20-25% result is what you should expect when you're doing an IVF. And then she was startled. She was like, how can you say that? How can you say that I will only get 40-50% result? You're not even done any test for me. I said, I'm telling you on basic idea of the age. I will further do all those tests for you. But then whenever I do a further test for you, I will only be able to tell you how less I'm going to get, not that how more I'm going to get. So what happens today is that, see, what happens is, if you look around, there are people who get pregnant naturally at 45 years, the people who get pregnant naturally at 45 years, 48 years and things like that. But if you look around, if you always say that, how many of those 44 years or 48 years are getting pregnant?
Lottery जैसे किसी किसी की लगती है ना.
And another issue, challenge, what happens is, especially with these donor treatments and things like that, a lot of people with 45, 50 are all getting pregnant. So something comes up in a newspaper and things like that. Okay, when you're reading, that lady got pregnant when she was 40. I'm just 50. I'm just 40, or I'm just 38. Why would it be so difficult? See, if you look at film stars, or if you look at Hollywood.
When Kareena got pregnant at 40, she's 40.
Yeah, that nobody's going to get pregnant, but if you look at the possibility of them to get pregnant is much lesser. So that is one of the reasons that we should always, I think we always.
And what happened? I want to know the story. What happened?
She just left. She was not able. She was not able to accept it. So what happens is, when you tell them, see, a lot of people say that they cheated you. See, the one issue with the IVF specialty is that whatever you say and do, you're not able to get a result beyond a 40-50%. So you should accept it for fact that 40-50% are going to fail. So when they fail, whatever you have counseled till that point of time, they forget about it. They'll say that, no, it failed. See, there are people who say that I'll give you 80% result, I'll give you 90% result. But it is still that they fail. They say, oh, unfortunately, you fell into that 10% which has failed. So, but every patient will have its own results. For example, a young patient, an older patient will have lesser results. So we have to tell them what results they should expect. When I say you get 30% result, 10 people like you, if you do an IVF, 3 of you will get pregnant in the first attempt. Not that you so it should be very clear in your mind that you should not have a very negative impact, thinking that, okay, you're never going to get in a result.
So many people leave the treatments and they naturally get pregnant later on.
Yeah, that is one of the biggest kind of ironies what you see in fertility, that you do, especially in unexplained fertility. You end up having a lot of treatments and they don't get pregnant. You do an IVF, they don't get pregnant. After that, they completely forget about all this and they get pregnant spontaneously. So fertility is a very complex thing. So even if you do an IVF, we have so many people who get pregnant after an IVF naturally. See what happens is, I think that relieves the stress. See, today,
I know stress is the thing that kills. The baby also doesn't want to come. Said, I'm not coming. You're too stressed.
True. So that whole idea that stress definitely has a major impact on the fertility factor. So a lot of these people, because of that, actually get pregnant naturally after the IVF processes. Once everything feels, they forget. They say, I don't want to have a child, and naturally they'll get pregnant. So we never tell our patients that you will never get. See, you can never tell how much of a worse the situation, unless they don't have sperm at all or they don't have egg at all, that you will not get pregnant. We can never tell our patients that, but we have to tell them that. We have to tell them that possibility is less. So we need to do the treatment as soon as possible so that you don't lose that opportunity to get pregnant. So a lot of people will ask, then why do an IVF? If you say that you can get naturally pregnant, but then how long do we wait? If you wait and you miss that period, it's like a bus. You miss the bus, you don't get another bus that is coming. That is done. You lose that opportunity.
You lose the egg because compared to men, women have just limited number of eggs in a lifetime.
Yes, because the God is kind of, we're born with a fixed number of eggs, and that starts getting produced by like when you attain
You
your
start like your period.
periods and things like that. And then what happens is every month a few eggs keep on coming out, and they say 40, 45 or 50 years is when you end up going for a menopause, is when the complete eggs are completely shut down. And but then what happens is beyond, let's say 36 or 37, again your egg quality also will reduce of whatever remaining that eggs are there. The quality also will keep coming down. So that is why we always end up telling our people or the patients or the friends that we know that, for example, I think people are always scared to talk to me. I always say, it's time that you get pregnant, or you need.
You are the dadi and the grandmom keeps on saying, "Bacha kab ho raha hai? When is the kid coming? Show me your report. Show me your report."
The challenge here is that we end up, we have seen all these worst scenarios. Okay?
Yeah.
In all these bad scenarios, we end up seeing couples struggling for. Some people, it's so easy.
Also, I think it's very strenuous on the relationships. I've seen couples go through fights, and because women, they're injecting hormones, they have the stress of not having, they think that it's because of me or whatever, and it causes a lot of friction in a relationship.
See, even we had a very interesting study last year about psychological impact of fertility on the male and female, and to the conception that to the concept that it's always females. But to be very honest, we were surprised to see that even males are also significantly affected as far as psychologically, because like uski mardani ki baat na, that kind of that.
A lot of men don't even get it tested. They'll say हमने कभी नहीं है.
Yeah, see, that is the challenge. See, for example, in a clinic where I like how I practice, or the culture of the in my center is that we only speak to the husband and wife. We don't even have your saas, the bhabhi. We don't even let them enter into a clinic. Say husband and wife only into the clinic. Even if you're coming alone, you come alone. And unless we evaluate both of them, we will not go ahead with the next phase of treatment. So we always insist. We don't, because what happens is a lot of times your mother-in-law comes and sits with you, and then they will dictate of what needs to be done, what treatment. See, you can't even ask them the sexual frequency, because somebody is sitting there and saying that, okay, yeah. So these are things that these are challenges.
In India, the family is so like connected to the hip. Like everywhere they have to go together. Let them go to the gynecologist alone.
So I think them alone. You should actually give them that space, and a lot of these difficult situations, like a lot of difficult decisions, like when the egg quality is poor, when there is no sperm, or when there is no egg. I always believe, see, it should not be that a couple, they have to have a combined decision of themselves. Don't take an opinion from a third person, because see, there's always this thing that what your feelings of what you feel, only you can know. Nobody else can actually assess it. Only you will be able to understand what is there in your mind. A third person will always have a different perspective and think of it in different way. So you are the right person to take the decision for yourself. So we always say it's only the husband and wife. Don't discuss it with your relatives. Don't discuss it. Okay, you can have friends to talk. It is important that you need to have somebody to talk and take out
you and support.
But don't take too much of advice.
Yeah, but you have done 10 years of study.
So what happens is, for them, it's like they're having that concern, or they're having that.
Relatives will say, go to this temple, do this vrat, and eat this, eat that, ilaichi, and you will get pregnant. They'll have all kind of superstitions attached to having a kid. Have you heard anything weird that people have done to have a kid? Like any weird thing?
I would say, I think definitely that the temple factor. Then we have in Kerala, there's a temple there. We actually kind of roll on the ground around the temple. So that is a very popular thing that is for having a child. But see, to be very honest,
what is the success rate there?
but to be very honest, I'm a person who's kind of, I take in all what is positive in all these things also. I wouldn't say these are pretty negative, but I think that
psychologically you start believing it's a placebo.
Correct. It's a placebo. So all these things, probably, even though it is not really going to really affect their fertility per se, it is going to give them that mental strength, or it's going to give them that positive energy in them. That is indirect. See, if you look at the very controversial question of if there is God, again, it's like that. See, as long as it is going to give us something good in our mind, it is going to give us pleasant, it is going to give us the driving force, it is going to help us in going across our challenges. I think, yes, it is there. As far as anybody. So I think all these things, but only challenge is that you should not waste time doing only that. You should do treatment. You
No, but
should do
when
that.
they get pregnant, do they say thank God or thank doctor? What is this they pay first? I want to know.
No, but I think to be very honest, I think there are a lot of people who kind of uh, who are very very thankful to us. I think there are certain people actually, like, once they come back and show your baby to you every year. So these are probably these are those moments that we live for. Or okay, we see a lot of people ask, okay, it's your job that you're doing. Okay, but whatever we are doing it with our full heart. We actually are trying to do. Unfortunately, like I said, unlike a laparoscopic surgery or something that you have a fibroid, you do a surgery and remove the fibroid. That's it. Your commitment is over. But IVF or any kind of fertility treatment, you have to make sure that you take them through that journey, and you don't know whether they're going to get pregnant. How much ever the best group of patients they are, how much ever bad patient they are, they might get pregnant, they might not get pregnant. So I think the best way to judge a fertility patient, a doctor, is basically when you have sort of negative patients coming back to you, because the doctor has been so convincing. They're able to tell them about the possibilities. Because what happens is, if you don't communicate that well to the patient, they will go off after
Yeah.
the first, because they say, this doctor did and it did not get. But you should always tell them that the results of this treatment is only this much. So you say that the egg quality was little less, the sperm quality was little less. So you need to communicate. You have a 10% chance. You have a 15% chance. You need to tell them. See, there are people who say that even if I have 1%, 2% chance, I want
I
to
want
try.
to try.
I want to. There are people who say I have 50%. No, unless I
There's
have
100%.
100% result, I will not do a treatment. So
But is there any guideline, like, while since you are in Cochin and the rest of the India everywhere people want to go to gynecologist, is there any way that you can judge, like, some standards through which we should go, because it's an important treatment, expensive treatment, and there are a lot of people, as you said, they promise 80%, 90%. So is there any yardstick where you can, like, check, like, which doctor to go and which
see,
doctor not to?
it is very challenging. Probably, like I said, I don't know how right I am to say this, but it is a very challenging field. I think we doctors, whether especially in our field, probably we have to have that conscious to actually do what is, like I said, know what is best for our patients. So
Yeah.
it is very difficult to give that judgment or a patient to kind of understand. Sometimes you have to just trust the doctor, look around, see what is happening, see how trustful or how convincingly he is telling you what is treatment, how good he knows. See, a lot of people don't even have time to answer to their patients, but I think you have to talk to your patients. You
Yeah.
have to give them explanation to everything that you do. You need to clearly tell them why we are doing something like that. Why is there? Because people will tell you, like, yes, we agree that there is a 10 years of that we are studying, and probably so many years of experience that we have, that because of which we are telling you something. But as far as the patient is concerned, they would have checked Google and said that, okay, in Google they said do this, why aren't you not doing that? So we should be able to tell them and convince them this is why we are doing it, and why that is important to do it in this particular way. So like I said, it's very difficult. I think probably we have an IRT bill that is coming in the hopefully in the next couple of months, because it's already tabled in the Lok Sabha. Definitely, once we have more guidelines, we have more accreditation bodies which are more standardized, things will become more better. And then we will not have too many quacks or too many people who are giving false promises, giving false. I think all that will reduce when all these guidelines come into play and all these accreditations come into play, because all those are important.
Absolutely. Thank you so much, doctor, for joining in. And I'm going to keep in mind all what you said, and I'm going to talk to my friends also. I'm going to think about it. And these are the things we don't actively think about it, but future में problem now. इसलिए अभी से जैसे लोग mutual fund में
See,
निवेश करते हैं, invest in your own body and own happiness.
Yeah, sure. So that's what the whole idea, Palak, is that, see, even with this radio interview, my whole agenda is not to kind of teach people IVF or tell them what. It is for them to understand the basics.
Start talking about it also. Like, even if the idea comes to your mind, you start talking about it. You get your tests, you take a gynecologist appointment. That is our victory, that people have taken one step ahead.
Correct. So it is for them to be aware. A lot of people are not aware. Educated, well placed well settled people are not aware of it, and they end up losing time unnecessarily. So I think this is something that is a main message. Like I said, your first question is the most important question as far as today's generation is concerned, that how important age is, and that needs to be the first impression that goes to all our viewers.
Absolutely. Thank you so much, doctor.
Thank you so much.
And stay safe.
Radio City.